The Harbor-UCLA Medical Center Replacement Program, a $1.8 billion investment, is the largest capital project ever delivered by Los Angeles County. A transformative partnership between LA County's Board of Supervisors, Chief Executive Office, Department of Health Services, and Public Works is built to deliver world-class healthcare for generations to come.
It is a significant investment and infusion of resources in that general area, a $1.8 billion price tag to replace the facility, and what that will do not only for the residents who live there, who will have a new state-of-the-art hospital to go to, but also the small businesses in the area will also benefit from that infusion of dollars in that geographic area. So the South Bay as a whole will benefit significantly.
The community deserves it. They deserve 21st century and beyond care. They deserve the types of equipment that will help people to heal much faster. We're putting the caring in healthcare and the humanity into it.
I think Harbor has an irreplaceable role in this community. We are the southernmost level 1 trauma center in Los Angeles County. We are the sponsoring institution for close to 50 programs. And so we train approximately 500 trainees every year. And so chances are that if you've gotten your health care somewhere in the South Bay, you've been taken care of by somebody who trained at Harbor. For outpatients, we see about 300,000 patients a year. And that's across all of the specialties, from primary care, pediatric care, maternity care, to all of the subspecialties that you can think of. That is around 1,500 patients a day just coming to this campus for outpatient care. The ER has over 100,000 visits a year. And so those are patients coming in to get their acute care needs met. And then we do about 20,000 surgeries and procedures a year.
Our patients today are not the same patients that we had 10 years ago, 20 years ago. And so if we're going to be effective in serving them and providing them the care that they need, we need to ensure that we are growing and expanding to provide exactly what those patients need. We can't be the healthcare system of today providing the healthcare of yesterday. I'm certainly excited about our new hospital, our new outpatient clinic, our new laboratory building, and all of the wonderful opportunities that they will bring to help us to elevate the work that we're already doing to effectively serve our patients and our community here in the South Bay.
The Harbor-UCLA Replacement Program employs nearly 800 craft workers at peak. About 50% of those are actual local workers. So these are members of our community actually performing the work you see in front of us. As part of the program, we are providing a new 9-story hospital tower with 347 patient beds. We're also providing an approximately 400,000 square foot clinic building, which is what you see behind me. Additionally, there are various other support facilities that we are providing, including a parking structure, a new laboratory, and a new central utility plant.
We financed it through a couple different avenues. We use short-term financing, which is very low interest, and that's money that we got up front to help with the planning and the early construction. Once we progress through the project, now we're actually rolling that short-term financing into long-term bonds, like a mortgage on your house, a 30-year long-term bond. That will actually fund the remaining construction. That allows us to fiscally manage such a project this size and be responsible with our county dollars.
This is a tangible example of what equity looks like in application. Over 50% of those involved are women. So for a project of this magnitude, that is on time, on budget, it gives me great pride to be a part of the solution that we're bringing to this community. When you think about equity, it's about who's bringing this to the community, the resources coming to the community, and who will benefit from it as well. The Harbor-UCLA Medical Center Replacement Program gets a gold star from me, particularly because it's going to come in on time and under budget.